Once again, this is going to be a panel presentation on outreach to unsheltered veterans. We have several subject matter experts here who can talk about their experiences as homeless outreach workers focusing on veteran services. I'll introduce myself first. My name is Andy Taylor. I work for VA Pacific Islands as the social work executive, and I spent several years working for VA homeless programs as well. So I'll be moderating and asking the questions. I'll be doing the easy part, and our presenters will provide a little bit about their experiences. So without further ado, let me make sure that I have Steve unmuted. Unmuted you, Steve.
I'm here.
As it's listed on the slide. Mark, you want to go first? Introduce yourself. Tell us a little bit about what you do.
Yeah, good morning, everybody. Thanks for the opportunity to speak at the Virtual Veterans Conference this morning. I've been an outreach social worker at the VA for the past 3.5 years, and prior to that, I was a HUD-VASH social worker at the VA for about 4 years. And basically, I'm really, for the last 3.5 years, I've been conducting outreach along the west side and the leeward side of the island, and then providing direct case management and care to homeless veterans in the area. One of the aspects that we do is that we canvass all the parks around the island, especially in the west side, leeward side, north shore. What I also do is I always bring enough paperwork with me, because the reason being is that I always want to be prepared and help a veteran at the moment. Just never know exactly how motivated the veteran will be initially. And if I have those documents ready at the time, I can get them enrolled and registered and commence with services as soon as possible. One of the things I do initially is that when I encounter a veteran, I always identify myself as a social worker first, and then subsequently try to get information on where the veteran served, whether they're a National Guard, whether they're active duty. Not all veterans, unfortunately, are eligible for VA healthcare. And so what we do is we try to determine through our databases and through, SF-180, which is a form to request their DD-214 from the mainland in St. Louis. So I like to have all that available with me at the time, just in case we can't obtain their DD-214 or need more information. And then once we kind of get a determination if they're eligible, then we begin to talk story, have a real kind of casual conversation to see what their needs are and how we can best help them. Contrary to popular belief, a lot of veterans that I encounter may not initially be motivated for housing at the time. So they prefer to remain homeless, remain in their tent. They're surrounded by friends and a social support system. So they feel comfortable in that area. And part of what we do is we try to slowly work with them and utilize a lot of therapeutic modalities. I'll get into that a little bit later, but I won't go into detail. But initially, using warmth, empathy, and genuineness, using a lot of Rogerian techniques, kind of building trust and rapport with the veteran, just to make sure that we can help them as best we can. And then just determining what their needs are. Some veterans are more interested in getting benefits, so we explore VA benefits, whether it's pension or service-connected benefits. Other veterans prefer just to apply for Social Security benefits. So it's social work 101. We start where the client is, and we go from there, and just basically work outwards from there as far as what their needs and goals and overall objectives are. And then, just a case in point, I've encountered some veterans where initially they don't want any help at all. They won't sign the consent form, and so I'm okay with that. We just say that's fine. We'll continue to work, continue to basically persevere, and utilize some techniques to hopefully get the buy-in and engagement moving from there. Usually, if I'm talking about benefits, there's usually some buy-in with that. A lot of veterans, and I've encountered a lot of elderly veterans, they're not aware of all the array of resources at the VA. So such as pension benefits. If they served during the Vietnam era during active duty time, they're eligible for a pension of up to $1,100 a month. And a lot of veterans have that, they're just totally surprised and dumbfounded that they can qualify for $1,100 a month, assuming they have no other income. So that's really some initial buy-in. That's getting really the ball rolling as far as engagement and helping the veterans to basically explore more VA resources and services, and then getting them hooked up with medical care from there. Also working with outreach, other provider teams, HPAC, with the CBOC at the Leeward CBOC, and then getting them hooked up with mental health care and medical care and substance abuse if needed as well. And that's kind of the gist of it. We always got to be flexible, working with the veterans. Oftentimes there's families involved too as well, so dependents. So we're working together as a unit to kind of get everybody on board to participating in the outreach program and then making the transition to permanent supportive housing when they're ready to do so. And one of those methods where if they're still stuck in the pre-contemplation stage and contemplation stage of change, we utilize what's called the motivational interviewing modality. It's a very effective evidence-based treatment, and it helps veterans to basically recognize their ambivalence and kind of move past a lot of stuck points that they have. I won't go into detail. Unfortunately, we don't have enough time for that, but and maybe I know some other presenters have already discussed motivational interviewing, but it is an integral step to getting veterans basically a little more engaged in the service, because it is a client-centered treatment technique. It is evidence-based, and it really empowers the veteran to make their own choices as opposed to coercing the veteran into making a choice, because that, from my experience, it never works when the veteran is basically coerced or pressured to make a decision. There's usually going to be some fallout from that. So we basically help the veterans to make their own decision, and some of the signature themes of motivation interviewing are, developing discrepancy between their beliefs and behaviors, and kind of basically working on that method with them to making sure they're kind of reaching reaching better decisions for themselves. And then we always express empathy, which is really important to building rapport with a veteran, using reflective listening skills to make sure that we understand what they're saying and where they're coming from. And then we also address ambivalence. That's kind of one of the centerpieces of motivational interviewing, just helping them to kind of determine the best outcome for them and for themselves and their family if there's family involved. And then also we're looking at rolling with resistance. Very important with motivational interviewing. There's always going to be resistance. We want to reduce power struggles and just ensure that the veteran is really on track to basically getting the help they need. And then lastly, we assist them with just working on helping them to be sustainable and helping them to basically advocate for themselves. We call it basically self-efficacy, and giving them the confidence to make those decisions that maybe they were apprehensive of before. They were a little reticent to make those decisions to get housing, but hopefully now there's an opportunity where they can feel confident that yes, they can move into an apartment. Keep in mind, some of the veterans we come across have been homeless for 10, 20 years, sometimes longer. In the past, I worked with a veteran that had been homeless for 30 years, and he had never been in an apartment for 30 years. So it's quite a transition and adjustment for a lot of veterans that have been on the streets for a long time. And I know there's time constraints, so I'll just quickly share one experience I had with a veteran. This kind of speaks to the issue of basically never giving up and persevering. Worked with a veteran in the west side of the island, initially very resistant to services, but what we did is we just kept on kind of coming back and kept on talking with him, developed basically a rapport with the veteran. Eventually he was willing to sign the consent form, got him basically a pension, which he was very happy to receive since he's a Vietnam era veteran. And we eventually got him into the HUD-VASH program. It took a little while, but we got him in and help him with his documents, and eventually he got a voucher. And he was actually able to move into an apartment. He actually was moved into the apartment that he used to live in prior to becoming homeless. So that was a big motivator for him too. So it's kind of finding basically areas where the veteran's really interested. If they want to live in a certain area, we really work toward that to ensure that happens. But the interesting side of this story is that once the veteran was housed, within about 2 months of being housed, he suffered a heart attack. And the heart attack happened right in front of his apartment door. And luckily for him, his neighbor was kind of outside on that day and was able to call 911, and the veteran was able to get the medical attention he needed, and he survived the heart attack. But in my mind, I'm thinking if he had still been homeless, there's no way he would have survived that heart attack, just being the fact that he would have been alone and no one would have been with him at that time. So it's a true story. It really kind of hits home for me, the fact that we were able to help elderly homeless veteran pursue housing. Initially did not want to pursue housing, but eventually we worked with them and kept on using motivational interviewing and other techniques to help them make that transition to permanent supportive housing. And in the end, it saved his life, really. So it really was a collaborative effort for the veteran and everyone involved, and HUD-VASH program too. So that's kind of the gist of what I do. There's a lot of forms we've worked with the veterans on. There's a form for everything at the VA, and we do require wet signatures to begin. So we always have to be mindful of COVID-19 and those aspects. So we have full protection. But I'll let my other panelists speak about that in more detail. And I think that's about it. Like I said, I do cover the West Side, North Shore area, and we walk through each park and help each veteran as best we can, and we never give up, and we just continue to forge ahead and build those relationships and help them to pursue their goals, whether it be housing, benefits, reestablishing contact with family members, which that's another big issue too. So whatever their goals are, we try to basically work together to make sure those goals can be realized.
Thanks, Mark. Hit on a lot of the good things that we'll talk about today, so appreciate that. And next, we'll toss it over to Steve. Steve, Steve Kahana from Kalihi-Palama is going to introduce himself and talk a little bit about if you have anything to add to kind of Mark's description of what you all do as outreach workers day to day.
Aloha. Very grateful that you invited me to be here. I think Mark's experience was very extensive. I'm not sure how I'm going to cover more than what he stated. Most of the times, Kalihi-Palama will go through like the Chinatown area. We'll also go to Region 5, which is the Central and the North Shore area. We'll also go out to Region 6, which is the Upper Windward area, and a lot of the rural areas of Honolulu, like the mountainous areas. We find veterans just about anywhere, on a pathway to Velzi land, under a bridge in Haula, on a ridge, going up Pacific Heights. We'll find a veteran anywhere. They're very resourceful, they're very resilient, and they know how to take care of themselves. So, we will find a veteran just about anywhere we go. Those that are in the rural areas, we find that they tend to be more resistant, and they want to live a life of self-sufficiency. And what Mark talked about, like motivational interviewing, this comes into play. Like, it's easy for me to tell a veteran, thank you for your service, I'm really grateful. But it's much harder for me to show a veteran that kind of gratitude. And I really impress upon a veteran to allow me to show my gratitude by allowing me to plug him into whatever services they feel they need, whatever benefits they think they can use to enhance their quality of life. It's kind of a difficult undertaking because, like I said, many of the veterans we encounter want to be self-sufficient, and they want to be a little. They already, let's put it this way, they already practiced social distancing before COVID happening. A lot of the other veterans that we find in the metro areas, underneath the viaduct at Nimitz or in a park downtown, they have some other issues along with just being homeless. So we have to try to assist them with those other issues, and many of them are resistant to viewing those other issues. Some of our veterans experience issues with mental health. Some of our veterans experience issues with substance abuse, alcoholism, things of that nature. So it's just convincing them to receive help in those areas, sometimes they're resistant to the VA itself, because of some prior experience. And so we try to plug them into other services and maybe come around later to the Veterans Administration. But if they want to plug into the Veterans Administration, we'll give that call. I got Art on speed dial, so we'll give that call. And sometimes if they want to get off the street, and if we can send them over to a Barber's Point, to the GPD program, I got Macy on speed dial. That's the great thing about doing outreach in on this island is I think we got veterans covered. And my personal experience is that the veterans who are not accessing services at this time don't want to access service at this time. But when they're ready, we're ready. That's how we go about doing it. Thank you.
Thank you so much, Steve. All right, next up we have Art Miner, also from the VA. Art, if you want to introduce yourself and anything to add about your day-to-day in working with veterans.
Yeah. Hi, yeah, my name is Art Miner. I've been a VA social worker with a homeless program for about 5-6 years now. Seen it grow exponentially with the hiring of a lot more staff. So yeah, it's definitely a building, increasing program. So yeah, there's Mark was very thorough, and Steve was as well. So I don't have a whole lot to add, but yeah, I can just talk about my typical day-to-day. A lot of it has to do with like referrals from, our partners, Kalihi-Palama, U.S.VETS. If we get those referrals from those agencies, trying to go see the veterans, not just those agencies. We get referrals from the governor's office, the mayor's office, DOT, IHS. So yeah, a lot of partners, a lot of community agencies that are involved in this process of keeping us informed of when they encounter veterans and where they're at, and trying to get in touch with those veterans and assess them for services. And kind of like I guess the starting point for us is just verifying their eligibility. So checking their social security numbers, their date of birth, trying to locate their DD-14s, which is their discharge paperwork. And yeah, just verifying eligibility for VHA, because not all veterans, unfortunately, are eligible for VHA services, as there are several disqualifying discharge statuses that preclude them from VA services. But they're still maybe eligible for services in the community, whether that's the transitional housing out at Barber's Point or the rapid rehousing program. So yeah, a lot of it's depending upon those community providers for referrals. And then, yeah, going out, trying to have face-to-face contact with some of those veterans if they don't have phones, which a lot of them, unfortunately, do not have phones, and it's obviously hard to keep a phone when you're homeless on the streets. So, yeah, and then kind of starting where they're at, not all veterans or not all homeless individuals are interested in housing, unfortunately. So, even though we think like, oh, yeah, they should go get housing, but that may not be the case. So, trying to assess them, see where they're at, see if there's any immediate needs we can try to help them out with, whether maybe it's some clothing that we have from donations, some hygiene products, canned goods, other items like that, and seeing if they have food stamps, helping them, assisting them in applying for food stamps, the VBA, like non-service connected pension, like Mark described, the disability, if they're eligible for that, if they've been injured while they're in service. So yeah, trying to get their immediate needs met in regards to that, and sometimes it may just be continued engagement with them, because and just continuing to offer them services. Yeah, and also kind of piggybacking on what Mark said, just having all those forms available, because you never know what forms they may need, and what may need to be completed, whether it's like one of those VA-HUD-VASH, a housing assessment form, application for SNAP benefits, VBA pension, VBA disability forms, the health care application for the VA, yeah, and also consent forms as well. And during COVID, it's been a little more challenging. Obviously, we're we're required to wear our PPE to, and treat everyone like they're potentially COVID infected. So it's wearing the face shield along with a mask, the nose and mouth coverings, as well as using gloves, using lots of hand sanitizers, using the 6-foot social distancing requirements. If you are doing paperwork, make sure the gloves are worn, throwaway pens, and obviously the hand sanitizers.
Oh, that sounds good. And next we'll kick it over to Macy Sevaaetasi from U.S.VETS. You can introduce yourself, Macy, in addition to talking about your day and anything else you'd like to add about your day-to-day in working outreach. We talked a lot already about our roles and our goals with homeless veterans when we encounter them. And then, but if you could add any as well, kind of moving on, focusing in on maybe strengths and challenges or anything you've seen that's unique about this population.
Thank you, Andy. As Andy said, my name is Macy Sevaaetasi. I'm the outreach coordinator for U.S.VETS. I've been with U.S.VETS for a little over 7 years now. And so fortunately, U.S.VETS provides not just outreach services, but emergency shelter and transitional housing, as well as permanent supportive housing. And so, with the collaboration with Art, Minor, Mark, Steve, and a lot of other outreach providers, we're more able to serve our veterans across the island, not just with the services that we provide here at U.S.VETS, but other services that are offered, within the community. So I don't think I can add much more to what Art, Mark, and Steve talked about in terms of typical day-to-day, because they really hit it right there. They were on point. So I'll jump right straight into strengths and challenges. In my experience working with homeless veteran population, some of the strengths include like services and funding. Like federal funding from entities such as the VA, Department of Labor, and others allow veterans to access a wider array of services, not just the mainstream homeless resources like emergency shelters, transitional housing, and permanent supportive housing within our community, but also available are veteran-specific services such as GPD, which is Grant Per Diem Program, the SSVF, HUD-VASH, and then VHA eligible veterans can access the shelter beds, which are services that, would typically only be available for veterans and not your average homeless individual. Another strength is our increased collaboration with our non-VA healthcare providers. So the support from providers such as Kaiser, Ohana, HMSA, United Healthcare, this collaboration allows us to truly coordinate care for our veterans through the community team approach. This is especially important for our VHA ineligible veterans who can't access the VA healthcare due to their discharge or their length of service. Another strength that I've seen is our ability to verify our veteran status through multiple methods. So historically, U.S.VETS has always had to rely on VA to provide confirmation on whether a veteran is eligible or an individual is a veteran and is eligible for veteran services. Because the VA has that direct link to federal databases that access DD-214, TINKS, and other methods as such, we've always had to rely on that. Now, with the other method that we have now is our Hmis Vet Validation feature. With the great work from our Hmis team and the partnership with VA homeless programs, providers who access Hmis are able to use this feature to check whether their clients are a veteran or are eligible for veteran services. And then our ability to utilize squares. So U.S.VETS is, because we're a GPD and SSVF grantee, we have access to Square's database that will confirm a person's military background, whether they are eligible for Grant Per Diem, SSVF, or even HUD-VASH and VA healthcare. And then another strength is just to increase community involvement. church groups that do their own community outreach, individuals, private business owners, and many other community members who are willing to assist our homeless neighbors by simply picking up the phone and placing a call to the city's housing office or the state coordinator on homeless office or the VA or U.S.VETS or even Steve. Everybody has Steve's phone number on speed dial also. Just whenever they encounter a homeless veteran, as long as they're able to, make that call and connect that veteran who's sitting on the street in their neighborhood with another provider or somebody who's able to do outreach and outreach to them. Some needs, I would say, some of the needs that I've seen is just the need for more services for our clients with severe mental illness. Our homeless neighbors that are cognitively impaired and unable to comprehend or be successful in a regular shelter, which most shelters require independent living and independent living ability, but our clients with SMI make this challenging for them, as well as the community providers providing that shelter and housing care. Another need is in the recent years, we begun to see elderly and other veterans needing higher levels of care which is offered in not offered in typical homeless services arena. We historically have seen veterans with mental health needs and veterans with substance abuse issues, but more and more we see veterans needing assisted living and caregiving type services due to age, medical conditions, and or physical disabilities. Some communities across the nation have what are called state veteran homes, which are nursing home facilities and domiciliary with adult daycare. We don't have such a program here on Oahu for our highly vulnerable veterans. However, fortunately, even though it's at a minimum, we do have that medical respite beds that are provided by the VA through community partnerships that are dedicated to veterans that are medically compromised. On to the challenge. So we in outreach, we see a lot of challenges in working with our homeless veterans. Not to mention COVID presenting even more challenges these days, but there's just so many challenges. And one of the challenges that we always see is just transient clients, right? Being consistent in outreach efforts is important. It's a very important part to rapport building, but it's very difficult if we're not able to find our clients, right? If we can't find them. And homeless clients are transient for a number of reasons. Clients will go to where the resources are. They may live in one part of the island, but during some part of the day, they'll go to wherever they'll be able to find food, money, and other things. Then we also have the working clients, our working homeless, who some of us don't realize, but some of our homeless neighbors do work either part-time or full-time. And just like most of us, work typical business hours. And for this very reason, we may or may not catch them during our regular canvassing of the streets and encampments. And then another reason why clients tend to be transient is enforcements by our local city and state officials. Another challenge I would say is our hard-to-reach clients. Those that, our homeless neighbors that are getting more and more creative on where they live and where they build their makeshift homes. Some of them are deep into the mountainous areas, and others live over water, places where it would require some type of boating device to get to. And so we, then the outreach workers, have to be more creative as well to develop ways to reach them, incentivizing and maybe hosting events that bring them out of their encampment and their areas to a neutral place where we can, where services can be offered. And then lastly, I would say the last challenge that I would definitely want to touch on is recidivism. We continue to see veterans return to homelessness. We see veterans get into shelters and permanent housing, but then retaining their housing for whatever reason, then they find challenges retaining their housing for whatever reason. Some clients are unable to maintain in shelters due to a variety of reasons, such as the shelter rules, other shelter clients, individuals' needs are not being met at the shelter, and then clients that enter housing end up back on the streets for similar reasons, such as violating landlord-tenant agreements, continued alcohol and drug use, not able to maintain cleanliness of their units, and then increasing number of visitors. Therefore, when we outreach workers see them back on the streets, we have to start right back over again. When we know their history, so the positive is that when we know their history, their strengths and weaknesses, we can restructure our approach when we see them on the street. Because this time around, we know what works and what doesn't work for them when they're sheltered and housed. Outreach work will continue to be a learning curve for all of us. We will always have challenges, but we'll also see the strengths in our methods and in our clients. I think our role in this outreach arena will be to learn and adapt to each challenge and strength to reach the ultimate goal of housing our homeless community.
Thank you, Macy. And that you talked about the difficult to reach veterans, both geographically and due to still working on their own goals towards going to housing or different levels of engagement. And I know for the geographically hard to reach ones, ART's been asking us for a kayak to do outreach with for years. So I don't know if that's still stuck in the bureaucracy, ART. But move on. There's also been a couple of questions from the audience about our next topic, which is veterans who are maybe a little bit more resistant to services. I know we touched on it a little bit already. So specifically, how do you approach veterans who are resistant to accept housing or services? What does and doesn't work? And the questions for the audience were similar, asking maybe if you can share a unique or challenging example of persuading a vet to accept services, and if they're not ready to accept housing, how do you still instill hope for them, or what do you do? If Art, you can maybe take the lead on talking about that, and then we'll let other folks chime in.
Yeah, sounds good. So I think one of the biggest things is just building that trust and rapport with the clients. Whether it's just continued engagement, just maybe checking in with them, seeing how they're doing, seeing if if they have any needs to be met, doing kind of whatever they're within our range of services, trying to offer those services and trying to get those basic needs met, whether it's the medical care, the mental health, access to food stamps, even if it's just like hygiene stuff. So the continued engagement, trying to build that rapport and trust with them, checking in on them, they definitely start to notice that, and they may be a little more willing to, hear what you have to say, and when you start talking about services. And in regards to those that, instilling hope, I'd say that a lot of the veterans that, maybe aren't interested in housing, a lot of them don't appear to be hopeless. They're kind of good where they're at. Whether, we see it a different way, how could someone want to stay on the streets? And, so oftentimes it's kind of just our own preconceived notions about, someone not wanting services, and, how could someone not want, housing, and how could someone not want to get off the street? So, I'd argue that a lot of those veterans aren't completely hopeless. They do have hope, and they're good where they're at, whether they've been on the streets for, the last 5-6 years. Some of them have been out there for 20-30 years. So for instance, there was one veteran we were engaging with, for probably over a year or two, in the Chinatown area, and we just kept checking in with him, offering services, getting him hygiene stuff. Just kept talking about services and like, hey man, you're eligible for the HUD-VASH program. What do you think? You've been homeless for a long time. Are you ready yet? Just continued asking him that. And we were able to get him some income, some VBA pension. He didn't have any income at the time. So he's dependent upon, all the food banks and all the hot meals in the area there. And finally, eventually, after we got him the non-service connected pension, about $1,100 a month, he decided it was time to get off the streets, and he was agreeable to, work on the HUD-VASH program. We got him into emergency housing for a little while. That didn't pan out, but we still worked with him, and we were able to get him housed through the HUD-VASH program, and he's in an apartment in the Waikiki area now. So, and it seems to be doing well. It's just that continued engagement, just meeting them right where they're at, not trying to push anything on them, because if you push, that often, you get pushback from them. It's just, meeting them where they're at, using that WAG, that motivational enhancement, motivational interviewing, trying to see that the motivation for change, you know, and whether it's through like substance abuse treatment or mental health treatment, just medical care, all that kind of stuff. Let's see. I think, does that cover that? Does anyone have anything else to add?
Sounds good to me. I know we're coming up on our time. We have about 8 more minutes before we go into break. So we can, I know there were a couple other things that we wanted to discuss. I know you touched on the PPE and other considerations that we're trying to do during COVID. But how's outreach changed for you during COVID-19, during the pandemic, and how are you balancing your need to keep yourself and your other staff safe while you're continuing to meet the needs of the veteran? Because they are also vulnerable and on the street. So we do still have our mission, but how do we do it safely?
During our pandemic, Art talked extensively about the wearing of PPEs, and the face shield is problematic for us. Some of the areas that we go, the wind blows the face shield like away from our face, and next we start fumbling with the face shield. It becomes a distraction because our clients are watching us fumbling with the face shield, and things of that nature. The throwaway pen, we give them the pen, and so we find ourselves carrying a lot of pens, which is something different. It's been a while since we carried a lot of pens. Those kind of small challenges. We find that we have to carry extra masks to ensure our own safety by asking clients if they want to engage with us, that they please put on a mask, and we have to ask them to put on a mask properly. Some of those things we find that do, put off our clients. They sometimes, and it's not all the time, but sometimes they'll say, you know what, I just don't want to talk to you, because they don't want to put on the mask, never mind, I ain't got time for this, or something like that. So that kind of thing has changed. As far as our outreach team, we have to put safety first, everybody's safety, our safety, client safety. And so the social distancing and the mask wearing is paramount. And we're sorry, but if you're unable to wear a mask, and if you're unable to wear a mask properly, then we cannot engage at that time. One of the other things that's changed with the COVID-19 pandemic is available resources and people to come out. We know, we know that Art and Steve, Steve from the VA, they can come out in a moment's notice, but sometimes our veteran clients, they have other kinds of medical insurances, and medical insurance is tied to a service coordinator, and this is one of the biggest problems we have. The service coordinators have stopped going out. They will do phone calls, but it's not the same. There was a time where service coordinators used to come out with us, or we called them and they come out and meet the veteran or the client or whoever, and that's kind of really slowed down now. And the medical insurance does dictate a lot of the resources that a veteran might need at that particular time, especially those that are experiencing issues with mental health, with substance abuse, or double down mental health and substance abuse. So that's one of the biggest changes that we've gone through with the pandemic, is the availability of service coordinators for the medical insurances.
Thank you so much. And just with a few minutes that we have left, we might go a few minutes over and get to some questions, but just some very quick tips for folks. There might be I know one question we get a lot sometimes is, when people in the community encounter homeless veterans, we might have people in the audience who maybe don't work with homeless veterans every day, but they might see them in their neighborhood. What are the best things they could do to assist those folks that they see? I don't know, Macy, if you have any quick tips. We have about 2 more minutes, and then we'll try to get to a few of the questions.
Thanks, Andy. So yeah, some tips for our community members that want to help. Just, getting to know your community resources, like the VA, the, outreach providers in your area, in your neighborhood, by contacting like the National Call Center for Homeless Veterans, utilizing the Oahu Homeless Help Card, because that's a very good tool and a resource that can connect any homeless individual, not just veterans, but anyone that's experiencing a housing crisis. So utilizing those resources so that way you can connect a homeless individual to somebody or to an outreach worker or to a provider that can assist, and provide that service as soon as possible.
Yeah, Mark, anything to add or any other tips for folks who might encounter a homeless veteran on how to connect them to help?
Calling the National Call Center for Homeless Veterans. Also, we really work with our community providers, which is really essential. So we're grateful to work with a lot of agencies, Kealoha, Waianae Comp, U.S.VETS, especially in the West Side area, Alea Bridge. So once they reach, and I always hand out my business cards and always maintain contact with these agencies, just to basically expedite the process for veterans that need help, and they can call us, myself, or Art, depending upon where they are on the island, and that way we can come out and assess them, basically as soon as possible. So I'm always, it's Coconut Wireless too in Hawaii, so it's always, a veteran knows another veteran, and that message gets across, and they're calling either myself or Art or Macy. So it's really important to just have that kind of like social connection in the community so that people know there's resources available for homeless veterans, and there's also help that they can get right away.
Thank you, Mark. And so, yeah, we'll try to get to at least a few of these questions here. One good one that I think is good to discuss is, can you share the most unique or challenging example, or sorry, I think we talked about that one with service resistance, but what's the best practice for working with partnering agencies to find vets that are difficult to find? So I know a lot of times you might encounter someone and you try to go out and find them again, and it's difficult to find them. So you want to talk about that challenge or what your best practices are around locating veterans?
Yeah, I can add to that. Yeah, I'm thinking like it's just, having good communication with those outreach agencies, the other agencies that provide homeless program services, and yeah, contacting them, seeing if they've maybe had contact with a veteran. There's also in HMIS, there's a way that's the coordinated entry system where we can put a notice for an individual indicating that we're trying to get in touch with them, that we're trying to reach out to them, trying to locate them. We do have, bi-weekly meetings in regards to homeless veterans and which ones we're prioritizing and talking about any difficulties if we're trying to locate them. Obviously, with COVID-19, with kind of more enforcements going on, it's been a little more challenging to find some of them. Some of them are going more remote up into, the foothills or trying to avoid people, so to say. So that's been a challenge in respects to that. But yeah, just the communication with all the community providers. Macy and Steve, they contact us constantly when they have a veteran or if they're trying to locate someone. Just internal communication within our program itself. So yeah, the communication is key in that.
All right, thank you. And then, so one final question. Sorry if we can't get to all of them. I'm also going to type I'll type my email address in the chat box if folks want to follow up or have things there. But we had some questions about rural communities and specifically neighbor islands. I know we have mostly a panel here that are from Oahu, and I think while the VA doesn't have dedicated veteran outreach staff, we do have homeless programs, social workers, and staff on each of the neighbor islands, or in each county. We have homeless staff in Kauai, on Maui, and on Hilo and Kona sides. And there is some component to outreach that they do. We also have HUD-VASH vouchers. We have the rapid rehousing program, supportive services for veteran families. So many of the housing resources we do have on on the neighbor islands, and we're working to be integrated into the overall homeless service system there. And I know that our social workers on those islands work closely with the outreach agencies that are there to hopefully identify veterans. But we're constantly trying to improve our system of how we find veterans on the neighbor islands. And the VA has really made an effort in the last few years to increase the resources that are available on the neighbor islands. I think probably about 10 years ago, it was people from Oahu flying over a couple of times a week and doing their outreach and trying to house people. And now we have dedicated staff that are there, that are living in the community, that know those communities and are kind of working with the local veterans there. Like I said, we'll make these slides available online. I'll try to add our some of our contact information there if you'd like to follow up with any of us. If you do encounter a homeless veteran or need to get help for someone, you can the link to the homeless help card is there, as well as the number to call to connect a veteran to help with housing. Someone locally will follow up with them shortly if you're able to get them into that hotline. I just want to thank all our participants today. Please, you have a few minutes for a break, and then we'll be starting our next round of breakout sessions. You can go back to the conference webpage and find the links to the next round of breakout sessions there. So hope to see you there. But thank you all for your questions and participation, and thanks again to our panelists. Really appreciate the very difficult work that you do, especially during COVID, to try to safely provide services to our vets. All right, thanks everyone.